change of behavior. Right? The technology can do a lot of the things we're talking about here, but is healthcare interested in changing the behavior? Because a lot of this is human, right? A doctor actually using social or looking at the data or trying to go down to value versus volume, et cetera. I mean, that's a behavior change. So talk about how we can help educate people on the best way to get those that work for them or with them or around them to embrace these technologies from a behavior standpoint.
It's interesting. Most people, when they talk about behavior change, talk about it from the perspective of patients adopting healthier lifestyle. And it's rare that people ask about the behavior change inside of healthcare as an industry. So I really commend you. It's an astute question, and it's something that that I think many of us are really sensitive to. These are conservative organizations. These are organizations whose cultures grew out of, again, hundreds of years of experience with things that didn't work or things that were sold, maybe oversold. And so the organization has grown organically on paper, on clipboards, on dust collecting notebooks and the nurses' stations. There's a lot of change that has to happen in the infrastructure, in the process, in the workflows. That's the bad news. It's hard. The good news is that every single one of those people has that thing that Vala just pulled out of his pocket. They all have iPhones. They all share information. They all learn what it takes to relate to all of the different organizations that they're a part of. And so as we see organizations increasingly putting in the kinds of systems that we frankly use at Salesforce to teach people inside the company to communicate new policies or new procedures or new workflows, we're going to see those hospitals doing the same thing. We have some good examples. UCSF ran a really great study where they had people in the pediatric intensive care unit were using Salesforce to share best practices around some of the common things that people do all the time that can either cause an infection or hopefully prevent an infection. And they use that training, they use the social network that they had inside this ICU and the kinds of peer-to-peer recognition and really recognizing people that were high performing to convey and to communicate some of these methods. I think that people naturally, what we've seen in all these companies is they've mapped out how people like to use technology, how they like to communicate. And there's every reason to believe that all those technologies are going to find their way into healthcare and have the same kind of transformative effect that we've seen in every other industry.